Hello everyone, welcome to section 10 of our IV therapy training, practical session and skill validation. I'm your virtual instructor here to guide you through the hands-on skills that make IV therapy work. In this online module, we'll bring together everything you've learned so far, think anatomy, drip formulations, and safety protocols. Our goal, to build your confidence and competence even from a distance. Today, we're covering 3 subsections: hands-on training, scenario-based learning, and competency assessments. Whether you've got a simulation arm at home or you're just watching, you'll see these skills come to life. Let's get started with the first part. Take a deep breath. We're diving in. First up, hands-on training. This is where you master the physical side of IV therapy. If you've got a simulation arm, set it up now. No equipment, no problem, just follow along visually. Let's begin with IV placement. Picture a cephalic vein on the forearm. Apply a tourniquet 4 to 6 inches above the site. Feel that bounce? That's your target. Next, disinfect the area. Grab a chlorhexidine swab and clean back and forth for 30 seconds, then let it dry. Cleanliness is key here. Now take a 20 gauge IV catheter, hold it at a 10 to 30 degree angle, bevel up, and insert. See that flashback of blood? You're in. Advance the catheter a bit more, retract the needle, and secure it with a transparent dressing. If you're practicing, try this now. Pause me if you need time. Moving on to bag preparation. Imagine a 500 milliliter bag of normal saline. Check it's clear and not expired. Safety first. We're making a Myers cocktail. You'll add magnesium sulfate, calcium gluconate, B-complex, B12, and 2 grams of vitamin C. Wipe the port with an alcohol swab before injecting. Inject each additive, then gently invert the bag to mix. Don't shake it. Label it with the date, time, and additives. Pause and try this if you've got supplies. Now drip calculation. Let's run this at 125 milliliter per hour with a 15 drop per milliliter set. The formula, volume times drip factor divided by time in minutes. That's 125 times 15 divided by 60. That equals about 31 drops per minute. For a gravity drip, adjust the roller clamp to hit 31 drops. Count them in your head. If you're using a pump, program 125 milliliter per hour. It's that simple. Visualize this, or practice if you can. Last, troubleshooting IV pumps. If it beeps occlusion, flush the line with saline. Air in line? Tap the tubing and reprime. Check your pump's manual later for details. That's hands-on training. Take a moment. Any steps tricky? Let's keep going. Next, scenario-based learning. This is about handling real-world challenges. Watch these simulations and think through your response. Scenario 1, infiltration. The patient says, "My arm feels cold and puffy. The site's swollen, the drip's slow. What now?" Stop the infusion right away. Remove the catheter gently. Elevate the arm and apply a warm compress if your protocol allows. Document it. Time, site, symptoms. Imagine you're there. What's your first step? Pause and think it over. Scenario 2, allergic reaction. You've started a vitamin C drip and the patient says, "I'm itchy, chest's tight. Heart rate's up, could be anaphylaxis." Stop the drip fast. Give 0.3 to 0.5 milligram epinephrine IM and call for help. Oxygen if you've got it. Picture this. What do you grab first? Take a second to list your steps mentally. Ready for the next one? Scenario 3, fluid overload. During a hydration drip, the patient's short of breath, lungs sound wet. This is serious. Stop the drip, sit them upright, and apply oxygen. Call rapid response or EMS. Check pulse ox, it's dropping. What's your priority here? Visualize your actions. Rewatch this if you need to. These scenarios build your emergency instincts. They're worth practicing in your mind. Finally, competency assessments. In person, I'd test you hands-on, but online, we'll guide you to self-assess. Grab these checklists to measure your skills. For IV insertion, pick a site, insert the catheter, secure it. Aseptic technique is everything. Check yourself, tourniquet, angle, flashback, dressing. Smooth. Practice until it feels natural. If you've got a sim arm, do it now. For drip preparation, make a basic hydration drip. 500 milliliter saline with potassium. Verify the bag, calculate 100 milliliter per hour, set the rate. Are you accurate? Sterile? Test yourself. Pause and try it. For monitoring and documentation, run a drip for 5 minutes, check for phlebitis or infiltration, and record it. Note solution, volume, rate, start time, observations. Review your notes. Are they clear? Detailed? That's the goal. Practice these at home if you can, or visualize them step by step. Submit your self-assessment checklist via the course portal. We'll review and send feedback. That's Section 10, Practical Session and Skill Validation. You've explored hands-on skills, tackled scenarios, and learned to assess yourself. This is the core of safe, effective IV therapy. Questions? Post them in the course forum. I'll answer there. Take a break now, re-watch or practice as needed. You're doing fantastic. Keep it up.